Just had a half day today, so it's kind of nice. Just operating in the morning, coming home early. Nothing better.
Dude, that's a very early day for a general
It's
surgery
great.
resident.
I'm doing some surgeonc right now, so it's kind of nice. I just had a couple morning neck cases, a little thyroid, and then getting on out of there. So it's ideal day for me, I guess.
Those
What
are
about you?
awesome cases. They're very satisfying if done well. They're very satisfying. So I guess we'll jump right in here.
Sure.
So my name is Gerardo, general surgery resident, research resident at Cincinnati Children's Hospital. I'm joined today on this episode of the StayCurrent Forums with my friend Nikki, my man. Why don't you introduce yourself to the viewers and let them know where you're at?
Sounds good. Thanks, Rod. Appreciate the introduction. My name is Nikhil Shah. I'm actually a general surgery resident over at University of Texas Medical Branch in Galveston, a little island off the coast of Houston, if you will. Again, third year with an interest in pediatric surgery. And with that interest, I'll be going to the University of Michigan in July to start a 2-year stint there in pediatric surgical critical care and then surgical innovations research. That was a mouthful, but I hope you got the gist of it.
That's awesome. Nikki, super proud of you. I think that's like really, I think that when you think of pediatric surgery, academic surgery, Mott Children's obviously is like, a powerhouse. So that's amazing that you're going. Congratulations.
Thanks,
I
man.
wanted to talk today about a question that I get all the time that I have a terrible answer for, that I can't really answer. Is sometimes when other general surgery residents who are interested in pediatric surgery are like, Rod, like, it's a dog eat dog world out there. How do I get a dedicated research spot? And I have to kind of like almost embarrassingly say to them, like, well, I'll tell you that mine fell in my lap. Dr. Todd Ponsky came and did grand rounds at my home institution and talked about social media and how we could use it for surgical education.
Right.
And then I talked to him afterwards, and that turned into some phone conversations. And then he was like, I have an opening. Do you want it? And I said, yes. So I did not get my position, I think, the traditional way that most general surgery residents do. So I'm not very helpful in that aspect. Can you talk to me about how you found and landed, like, I don't know, to me, like a really cool, impressive spot for next year?
Yeah, absolutely. It's a good question. First of all, I wouldn't say you did kind of land in your lap. I mean, you use a little charm, right? A little smile to rope them in. Anyway, so for me, I was a little late to the game. I don't know about the numbers of it, but a lot of people interested in pediatric surgery typically, they right from the get go, they're like, I want to do this. I want to get into it. This is something I've wanted for years. So they have their plans laid out for them. After second year of general surgery residency, they go right into the lab or wherever it may be. So I'm here to kind of set the standard a little different. I decided at the end of my second year, beginning of third year, and I think traditionally general surgery residents, take time off between years 2 and 3, clinical years, to pursue something, whether it's laboratory or clinical research. And for me, given that I was late, I had kind of to make decisions a little bit quicker than other people did and kind of cut to the chase. So I think choosing a fellowship or a research year or years really comes down to what your goals are in terms of what to achieve in those 2 years. It's your career goals, your research goals, and then in general your social and life goals too, because those play into it a lot. I think some people, I think this would be a great 2 years to, spend time with my family, get research done, kind of a whole host of things. So that's basically things to keep in mind. For me, I think I wanted a joint clinical and research experience. I did not have the strongest research background coming into residency, to be honest. I was really gung ho about the clinical stuff, but did not have a lot of experience crunching numbers or doing data searches, things like that. So that's what I wanted, a little bit of both in here. And for me, critical care is just a really big part of my training, my interests, and then kind of what I want to incorporate in my future practice. So for me, that was a big play.
Yeah, totally. I A lot of what you said resonates with me because I think that we think we meet so many surgery residents on the at conferences or on social media who, like you're saying, they knew from the jump that they wanted to do ped surge, and
Right.
I think that they I don't know, for lack of a better term, they kind of got to white knuckle it a little bit because it is very competitive out there for pediatric surgery fellowship. And if you find out late, like you did, then sometimes it can be really stressful, but it is possible to find something. Or in my scenario, I'll tell you that I was planning on doing 5 years of gen surge and then getting out of there. And I started to learn early on in my residency. I was like, oh, darn, I think I want to be an academic surgeon. And I think that research wouldn't be the worst thing in the world when you think about it, because as far as building your career, like you said, I think the opportunities are immense. And if you end up at doing pediatric surgery research at a big institution, or really pretty much most institutions that have
Yeah.
research residents,
Mhm.
the opportunities are tremendous. So highly recommend it.
You made a couple
Can
good
you
points actually. I just wanted to jump in real quick. Is
please?
the whole aspect of okay, I going through my 5 years. General surgery is already long as it is, and just adding years and years. Now with people subspecializing, subspecializing. I mean, the list goes on and on. And then by the time you're 10 years later and you blinked and you're finally done with their training. But for me, I also came in the same way. I was vehemently against research. I was like, I want to do my time. I want to get done, be trained, do a fellowship maybe, and then be out of there. But come to think of it, I mean, after experiencing just truly good pediatric surgical rotations and just seeing what this field had to offer, taking the 2 years to learn more about the field, refine myself, refine my interests, seemed like a drop in the bucket, honestly, in terms of the long years anyway. So, my thought process has changed significantly in terms of oh, these 2 years are everything. But honestly, if it's forwarding your career, if it's doing something you're interested in and will let you live the life you want to live or the career you want to do in 5, 10, 20, 40 years, so be it.
Yeah, I 100% I agree with you. And I joke all the time that, I mean, you've seen me on social media. I joke all the time about how, I'm going to be geriatric before I finish all of my surgical training. Like all of my classmates, this is another joke that I have with some of my friends from med school. Is like, it's out of the med school class. It's like, who's going to be the last one to finish their training? Is it me, or is it one of my friends who she's a neurosurgery resident right
Ooh,
now on research? And I was like, honestly, I think I'm going to be the last one in our
rough
whole med
battle.
school class
Rough
that
battle. Yeah, we'll see. I'll put some bets on that for you. I'll throw some money.
go to
Uh,
Vegas and put some bets on it. I want to piggyback off of what you just said. Can you give one piece of advice to a lot of our listenership is general surgery residents. Can
sure.
you give one piece of advice to those surgery residents out there in regards to uh, finding research, or finding, even outside of that, kind of like like what you were saying, the career that fits for them?
Yeah, no, definitely. I think it all starts kind of at your home program. So I think you want to kind of take a look at what resources your program has to offer. First of all, talk to mentors, talk to faculty, talk to even chief residents in your program to see what their goals are and how they approach them. And then all kind of, yeah, like I said, starts at home. So see what is theirs to offer. Sometimes your mentors have connections with other people at other institutions, and they have just pearls of wisdom to hand to you. And that's kind of how I approached it as well, just connections and connections. One thing I will specifically for pediatric surgery, if people are interested, the APSO website has a phenomenal tab. It's just a great resource, not only to learn about other pediatric surgery fellowship programs, but also pediatric surgical critical care fellowships, research opportunities. I mean, I remember the day I basically decided on pediatric surgery, I went to that website and I was just overwhelmed with just information. And it took days and weeks to just sort through it, to look at all the opportunities out there from California to Florida to, Michigan. And, you got to get organized. You got to get organized quickly. But the APSO website has it all for you. So, there's really no such thing as too much information, but I'd venture to say it's overload there, but to a perfect degree. Because a lot of these, especially the critical care and even research positions, are what we will outside the match, where you kind of have to do a little bit of talking beforehand, email, get your resume, CV out there, personal statement, letters. So it's the same process in terms of what you need to apply, just a different format and a different forum. Um, so I think that's something to look at. It if pediatric surgery is what gets you going. And then in terms of just deciding is what type of experience do I want? If you've had a lot of experience with research already, then maybe 2 to 3 years of research is not what you want, but instead a clinical fellowship that some people do, at Cincinnati, at Michigan, in terms of fetal surgery, They have pediatric surgical critical care. They even have certain colorectal surgery fellowships. I know at Children's National, things like that, that you can gain clinical experience instead of the research heavy route. And like I said, you just kind of look within yourself and see what do I need to make myself well rounded. What do I want to gain from these experiences to make myself a better physician, a better resident, a better fellow, and then eventually a better pediatric surgeon, I think.
Ultimately that's the goal, right?
Yeah.
Is we want to be the best possible pediatric surgeon for that patient that we're going to care for
Hmm.
when we're attendings in another decade, probably.
Yeah.
So
Awesome.
with that, this was awesome. I love this conversation. I can't wait to have more with you.
Absolutely.
So you also made a good plug for Children's National Colorectal Fellowship. There are a lot of good clinical fellowships out there. We even have a podcast with their clinical colorectal fellows right now called the
Perfect.
Colorectal Quiz. So the other subset of types of academic, I don't know, fellowships or surgeons out there.
Mhm.
I think I fall into this category, and Dr. Todd Ponsky fall into this category of now academic content creators. So we'll have more episodes like this coming for you guys, and we have more topics. We have so many things to unpack. The complexity of a general surgeon in 2020. Can't wait to speak with you more. Thanks for coming, man.
Definitely. Thanks for having me. It's a great experience. Looking forward to delivering some more good content.